Welcome to the She Found Motherhood podcast. Today, Candace tells us about her birth story, challenges getting pregnant, and then a complicated pregnancy leading to an absolutely beautiful birth of a sweet baby girl, Savannah. One of the things she chats about is the challenges with sleep deprivation after baby. So just so you're aware, we have a great Newborn Sleep 101 course. This helps prepare you for what to expect in that postpartum period, gives you some tools and tips and tricks on how to encourage your baby to be the best sleeper they can be, and how to make sure that you have the support that you need to get the sleep. All right, we'll get to it right after this quick reminder. Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, two doctor moms who are creating a community rich with high quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the 4th trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood, or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated. Hello, Candace, and welcome to the She Found Motherhood podcast. Today, you are willing to share your birth story with us, which is so amazing. Before we get into that, why don't you start off by telling us a little bit about yourself?
Yeah, so my husband and I live in Charlottesville, Virginia. It's beautiful out here if you ever make it down here. We have 2 dogs. They're my first babies. And then we have our daughter, Savannah. I'm a school teacher. I teach middle school, which is always exciting. And I'll share a little bit later, but I recently just became certified as a birth doula. So looking for a little bit of a career switch within the next year.
Very cool. Now,
Yeah.
we can talk. What motivated that? I'm curious. What motivated that kind of change?
It took us a little while to get pregnant. And so I read a lot and became a little bit obsessed with birth and pregnancy, and following the birth of Savannah and just what an incredible experience we had. I realized that I wanted to be able to support other families in the way that Mitchell and I were supported. We actually did not have a birth doula. We thought I was going to have a C-section for most of my pregnancy. But yeah, after the birth that we had and just being able to talk with other women that are so fearful of labor and fearful of birth, I just knew that I wanted to be able to support families. So super exciting. It's a big switch, but a lot of teachers actually become birth doulas, which is interesting. So,
Well, I guess, a lot of the skills are kind of transferable, right?
yeah,
You're used to
they
kind of
are.
helping people through challenging processes and
Yeah.
making sure people understand. That's amazing. So now I'm really intrigued about, you set us up amazingly. Okay, so why don't you tell us a little bit about, it sounded like it was a bit challenging to get pregnant in the first place. So if you don't mind sharing kind of what that looked like for you and your
Yeah,
husband.
so I had been on oral birth control pretty much since like 9th grade. I had really severe periods to the point where like I couldn't go to school some days. So then after we got married, I just was like, I don't want to be on birth control anymore, even though we weren't quite ready for kids at that point. And so I came off of it in 2017. We didn't really start trying until December of 2018. And just like most women, I thought it was going to be super easy. No problem. And a couple months went by. I was tracking everything. I kind of knew the window of time that I was ovulating and nothing was happening. And I then kind of began to have just like some weird spotting that just wasn't normal for me. I'd always had pretty regular cycles, and So I went back to my OBGYN, just kind of curious, like, hey, what would be causing this? Um, they told me everything looked great. There was nothing that I needed to be worried about. On average, it takes most women about a year just to kind of be patient and trust the process. Um, and so we continued into the summer of 2019. And I just was having crazy fatigue. My skin was super dry. I just didn't feel like myself. And I've always been a fairly active person. I'm a runner. I go to the gym, and I would in the summer go for a morning run and then literally just be on the couch all day. And I'm like, this isn't normal. Something's going on. And my mom's a nurse. So, of course, she was like, you got to go get all your blood checked out and have them run all these tests. So I called my OBGYN again rather than my general practitioner because they kind of knew that I was having some weird symptoms. And so in the fall of 2019, we did like a full blood panel. We looked at progesterone levels and all of that. And they actually diagnosed me with hypothyroidism, which looking back on all of my symptoms made total sense. And that's when I really began to kind of understand just how significant the thyroid is in conception and being able to carry babies to full term. And so our doctor was like, I know you're not going to want to hear this, but I'm going to put you on levothyroxine, the lowest dose. We're going to continue to kind of check your thyroid levels, give it 6 months, which at this point we'd been trying for almost a year. And I'm like, no, don't tell me that. Those are like the worst words to hear. So I really went to kind of a dark place. I stopped working out. I was just kind of like, if my body can't do this, I don't care about my body, which is the worst mentality to have. So we were still trying, but at that point, it had really kind of put a strain on our marriage. My husband was just feeling kind of, I think he felt grief for me because for him, he didn't understand how I was feeling. And I felt like my body was broken and couldn't do this thing that it was supposed to be able to do. So we kept trying. I was still having some kind of weird symptoms with my cycle. And so I was going pretty regularly to my OBGYN. He definitely remembered me every time I came in, and he sees a lot of patients. So finally in March, right before the world kind of shut down, I had an appointment in March of 2020. We ran some tests, and he basically was just like, I don't really know if you guys are going to be able to conceive naturally. There's nothing specific that I'm seeing, but clearly I think it's time for us to start looking at, some alternative routes for you and your husband. And so I left that day, of course, as I'm walking out of the waiting room, seeing a close friend who was about to have her first baby in a couple weeks. And it was just so hard. I cried the whole way home. My husband works nights, so I woke him up and kind of told him what was going on, that we were being referred to a fertility clinic. And lo and behold, the next week, I woke up so exhausted, craving like fried chicken, which is something I never want. My dog was following me around everywhere to the bathroom. I called my mom and I was like, I know I'm not pregnant, but I'm having all of these symptoms. And she said, honey, I know like you've been going through this for such a long time, but maybe, maybe you're just stressed and that's why your period is a day or two late. You just got some pretty devastating news last week. Just try to be calm. Well, of course I couldn't. So I got in my car to go get some chicken, and I passed a grocery store, didn't tell anyone, picked up the pregnancy tests, came home, and I got my first positive. Literally a week after the doctor had just told me that he wasn't sure if it was going to be able to happen for us naturally. So yeah, that is kind of our journey to getting pregnant. And it's so hard, and something that someone stuck with me that I want to encourage any listener going through this. It doesn't matter where you are. It doesn't matter if you've been trying for 6 months, 6 years. It's okay to feel the feelings that you're feeling. And I needed someone to validate that to me because I looked and saw all these other women who had tried for so much longer and felt like I couldn't feel the sadness that I felt in my waiting. So yeah, I just want to encourage anyone that might be going through that right now. I know
I
that
think
that
that's
can,
I think that's such an important message, right? It's okay to feel those ways, and it's really important to acknowledge that, right? It's important to acknowledge those feelings because it's so hard. Like I thankfully never had issues with fertility, but I have a lot of patients who do, and it's it's I can't imagine that having to wait month after month, year after year, and not knowing if your hopes and dreams. Because once you, I think once you decide to have children, you become a parent,
right.
right? And then it's kind of ingrained in you. And so, yeah.
Hmm.
And your comment about your body letting you down as well, like
Yeah.
I think that probably rings true to a lot of people, even if it's not pregnancy wise, in whatever respect. And it's that is a really challenging thing to kind of work through as well.
Yeah.
Yeah. Thank you for sharing that. I think, yeah, I
Yeah.
agree with you. I think those are really important messages for people to kind of recognize. Um, but now here you are, you're pregnant
Yeah.
in a pandemic. Amazing.
Yes, not I was just like, are you kidding me of all the times to get pregnant? It actually ended up being kind of better for me, especially with teaching. I had a lot of first trimester nausea and morning sickness. So all of my students would have known that I was pregnant. And I personally wasn't quite ready to share with everyone. So it was nice to be able to be home working virtually, and have the comfort of my toilet 2 feet away from me. Which, if you're a teacher or have a job where you don't have access to a bathroom, you understand the importance of that. So, yeah, I immediately called my OBGYN, to let them know. And the practice that I go to is a rotation of doctors. So the doctor that I had been seeing wasn't actually going to be able to be the one that I saw after my first ultrasound. And so, I obviously went by myself. My husband wasn't allowed to go due to the pandemic. So shout out to all the pandemic moms and those that are currently going through it. It can be scary and lonely, especially as a first time mom going through that. Um, so I get there, of course, I'm anxious, nervous, excited. And I remember the ultrasound technician saying, have you ever had an ultrasound of your uterus before? And I said, no. And I could just tell from that comment that something wasn't quite right. And I know she was giving me her best poker face and trying to remain calm. And so she showed me the baby, and I got to see the heartbeat, and I felt so assured. And then quickly, kind of on the other side of my uterus, I could see another sac, but it didn't look quite the same. And so I knew in that moment that we were potentially pregnant with twins, but I also could tell, just from my own research and kind of knowing about a little bit about pregnancy, that something just didn't look quite right. So then, of course, you have the dreaded wait before you go see the doctor, where they read the results and tell you all the things. And I had an amazing doctor. She had great energy, came in, and the first thing she said to me was, "You have a beautiful, healthy baby. But," and I was like, okay, here's the but, "you have a very strange uterus, my friend." And I'm like, what do you mean? Doesn't everyone's uterus look the exact same? And so that is when I learned about all the different kinds of uteruses that women can have. And so, as close as they could tell, she diagnosed me with a bicornuate uterus, which, for those of you listening, it's kind of shaped like a heart. And you can correct me if I'm wrong, you're the doctor, but some women have like a complete split down and some it's partial. Just with the technology that was at my particular practice, they couldn't tell how split mine was. But there were definitely the two kind of heart-shaped parts of my uterus. And so she went on to kind of explain some complications that could arise with that, but really assured me that they had actually had randomly quite a few patients with that type of uterus and were familiar with it and knew what to do in case of any of those things. And then she went on to share with me that that we were pregnant with twins, but that one of the babies did not look viable. At this point, I was about 7.5 weeks pregnant. And that they would want to see me again in about a week and a half. And I just like started sobbing. How could I have gone through this journey of getting pregnant and then finding out at my first appointment that I had two babies, but that one of them probably wasn't going to make it. And then it, of course, puts fear in you. Is my other baby going to be okay? And so I just cried, and she let me cry, and she assured me that it was okay to feel that way. And so, yeah, I went home and told my husband what was going on. And of course, he was very confused and um, didn't understand. What do you mean your uterus is weird? And how do they already know that one baby isn't viable? And so, went back a couple weeks later, and they officially ruled it as a twin demise. And the other baby was actually on the other side of my uterus. And so they weren't particularly concerned about it impacting Savannah, or the baby that we now know as Savannah. So yeah, it was really strange, grappling with all of that, right? Like knowing that I have a healthy baby, but also knowing that I had lost a baby. And so, kind of following that, I just became super anxious. I didn't want to celebrate the pregnancy that I did have because I was scared. I was scared of what could happen, and just fearful of getting my hopes up and being excited. And luckily I had great friends and my husband and my mom to support me through that, to where I could get to a point where it was okay.
Can I
For
just
me to,
interrupt you for
yeah.
one moment? I'm just thinking of how challenging that must have been for you to come home because your husband couldn't be there at your visit. And
Mhm.
that's not a uncomplicated kind of start to a pregnancy, right? Like that's a
Right.
pretty complex start to a pregnancy that isn't talked about a lot, right? We
Mhm.
just did a podcast on twins, and we think about a third of twin pregnancies actually result in a vanishing twin. So that
Mhm.
first one of the babies is lost within the first kind of 12 weeks. And if that happens, it shouldn't have a major impact on your pregnancy. But that added on with kind of the bicornuate uterus, and then having to go home and explain that to your husband, who I'm assuming is not a medical person.
No, he's not.
And you're not a I mean, you've done a ton of reading, so you're probably much more educated than many people going into pregnancy around kind of pregnancy stuff. But like that must have been a really hard conversation to have because I suspect he had lots of questions that you may or may not have had the answer. And then he can't even come to follow up to ask those, right?
Right. Yeah. It was really hard. And I think for him, um the grieving process, he never saw that baby. Or I know it's, obviously so much different for the woman carrying the baby, but I felt this deep connection to this baby because I saw that baby on the ultrasound. And so for him, it was just hard for him to know how to support me, and also be informed about what was going on, because I think he was also fearful of asking me questions and that sending me down a spiral of just being emotional. So yeah, it was definitely hard. I actually had a really great girlfriend who would come sit outside with me, 6 feet apart, and just kind of let me talk with her. And so that helped a lot. And just being able to recognize that I could be excited about my pregnancy, but also be sad, that there was a baby lost. So, and I did have a little bit of like bleeding. Obviously, they didn't know if it was from that, or sometimes in the first trimester, women just have it. So that, of course, again causes more anxiety. But my doctors were amazing and just reassuring me and always answering my calls and letting me come in if I felt like I needed to have anything checked out. So, yeah, up at 13-week scan, everything was great. Savannah looked great. We still hadn't decided if we were going to find out gender. I did not want to know. My husband wanted to know. And really into the second trimester, things were great. I felt amazing. I was surprised at how great I felt. I stopped running in the first trimester just because with the spotting, it just made me a little bit uneasy, but I was still exercising. The nausea went away around 10 or 11 weeks. So I just really started to feel like myself again, as much as you can when you're pregnant. Um, and then at our 22-week, we had like the big anatomy scan. For the most part, everything looked great. They did think that Savannah might have clubbed feet. And so that kind of started our spiral of, I felt like every time we went, we were having an ultrasound. But because of my uterus, she was just kind of oddly shaped and positioned inside of me. And so it was just hard for them to get a good scan. So at that point, she had turned to be head down even at 22 weeks. And so they were somewhat optimistic that she probably would not be breech, as most babies with the bicornuate uterus, it's hard for them to move once they get to a certain size. So they had kind of ditched out the idea that I would have to have a C-section. At my first couple of appointments, they were pretty sure that I would probably have a C-section if she had been breech, just because that's what aligns with their practice. So I hadn't really thought that much about birth. I was just like, oh, I'm going to have a C-section. Like, my mom had a C-section with me because I was breech. So I read all the things about C-sections and scars and desensitizing your scar and all of this knowledge that I ended up not needing. But so then hitting the third trimester, around 30 weeks, they wanted to do just another scan just to see her growth, because a lot of times women with bicornuate uteruses or oddly shaped uteruses, their baby will have issues getting bigger, or there can just be things that they want to closely monitor. So she, at that point, was measuring a little bit lower in her percentile than she had been. And so they wanted to start monitoring me just a little bit more closely to make sure that we didn't have in uterine growth restriction, which again, just second trimester, I felt like I was on this high, and then we hit third trimester and I felt like I was back to being anxious and reading all the time, which don't Google. I know everyone tells you that, but don't do it. If you're listening and you're pregnant or you just had a baby, don't Google.
Find some good, high quality resources, trust in your provider, ask them your questions. 100% agree.
Yes. So around 33 weeks, she had again dropped even further in percentile. And so at this point, I was going every week for a non-stress test, and then doing an ultrasound like bi-weekly. And at 34 weeks, my mom was here, my husband's family was here. We were supposed to have a baby shower. And I woke up having like these extreme, what felt like menstrual cramps. And I remember saying to my mom, I'm like, what is this from? And she was like, I had a C-section with you. Like, that was 30 years ago. I don't remember. Like, text a girlfriend who's just recently had a baby. So I just kind of ignored it. And I was actually, at that point, I was walking like 3 or 4 miles a day with my dogs just to kind of stay in shape. And so I went out to go for a walk, and I just like couldn't, like the pain was so unbearable. So I called the doctor. It was a Saturday, of course. These things always happen on the weekend when you can't just go get checked out at the office. So I called the doctor on call at the hospital, and she told me to come in. And so I got there, and I was having contractions 2 minutes apart. I was not dilated at all, but I was about 85% effaced. And so it became real very quickly, that we could potentially be having a baby that day fairly soon. They were hopeful to get me to 37 weeks. And so they started some fluids, and we just hung out for a little while in triage, and they, were monitoring her and making sure that everything was okay. And they gave me the shots for steroids, or the steroid shot for her lungs to develop them in case she did come, since we were only 34 weeks. And I came back the following day. So I ended up going home. My contractions slowed down. I came back the following day to get the second dose of that. And at this point, they were like, okay, we want you coming in twice a week to the office just to make sure everything's going okay. And so we kind of felt like, all right, she's probably going to come fairly soonish, but we are hopeful to get to 37 weeks. And so they didn't put me on bed rest or anything like that, but just kind of told me to take it easy and, not go run a marathon or anything, which at that point I was not feeling like doing that anyways. So we continued going to our appointments. And we had just hit 36 weeks. And we knew that we were having a big growth scan at this appointment. And this would kind of decide if they were going to want to do an induction if she really wasn't growing. And she had again dropped in percentiles. And so I told my husband when we left the ultrasound room, I said, okay, like they're going to schedule an induction. I just need to prepare you. And he's like, no. So they came in and the midwife was like, all right, here's the calendar. Like, what date do you want to do? And so 37 weeks would have actually been election day for me in the States. I did not want to have a baby on election day. So we scheduled it for November 5th and we left and we felt great. That was on a Thursday. So we kind of prepared our family and our close friends, letting them know that that would be happening. And at this point, I knew I was going to be having a vaginal birth. And I had just finished like a childbirth education course. And that's when I decided that I wanted to go unmedicated, which was super surprising to my husband and my family because I do not have a high pain tolerance. Like I sprained my ankle and I totally milk it. I'm like, everyone needs to wait on me. So I was reading a ton about kind of induction and how that looks without getting an epidural or other types of pain medication. And that Saturday, which was Halloween, it was also a full moon for any nurses. I know you guys believe that that's a real thing. And my husband was sleeping. He went into work that night. And so I went to go drop off a friend's baby shower gift. And I was standing outside on her stoop and we were just chatting and I thought I was peeing myself. And I was like, oh my gosh, like her husband's standing right there. Like, I don't want to like go in their house. There's a pandemic going on. It was awkward. So I just was like, I have to go to the grocery store and like take off running to my car. And by the time I got in my car, like I was soaked through to my shoes. I'm still in denial that my water has broken. So my husband is asleep. I don't want to wake him up. So I call my mom who lives over 2 hours away. Like, what is she going to do? And I tell her, I'm like, I either just peed myself a lot or my water broke. And she was like, are you safe to drive home and get Mitchell? And I said, yes, I think so. So I drove home. I could still feel the baby moving. So I felt, okay. And I'm laughing, like I'm having no contractions. I'm like, this is hysterical if my water has broken on Halloween of all days, right? Like 4 days before we're supposed to be induced. And so I called the doctor on call and kind of told him what was going on. And he was like, it definitely sounds like your water broke. So why don't you come in? My husband, still in denial, hasn't installed the car seat, even though we'd had a scary preterm like 2 weeks before. I was like, this was your one job. So he grabs the car seat, puts it in the car. I already had our hospital bags packed and we get there and they were like, oh yeah, your water broke. On the way, I started to have like minor contractions. Cause that was something I was fearful of too, was my waters rupturing and then no labor actually starting. But on the way there, so car rides can sometimes get those things going. So yeah, that's our pregnancy up until our labor and delivery. So
Very cool. And how far along were you at this point? Kind of
I was
36 and a half, 37?
Yep. I was exactly 36 and a half. Yep. Mm-hmm.
Cool.
So
Cool. So you almost made it to the 37-week goal.
almost made it. We were
But that full
so
moon,
close.
hey?
Yeah. That's what we're going to blame it on. So yeah, we get there and of course I am like still laughing because that's how I deal with things. I think it's funny. And my husband is like, all right, so we probably have like 12 to 15 hours, right? Like that's the average for most first time moms. I'm like, I don't know. Like, we're just going to see how it goes. And I had amazing labor and delivery nurses. I actually did not hire a doula because for most of my pregnancy, I believed that I was going to be having a C-section, which you can still have a doula if you're going to have a C-section. But I just wasn't something that I had really looked into. And so I didn't have a birth plan per se, but I did let them know pretty much as soon as I got there, I want to go unmedicated. Please don't offer me medicine unless like I ask for it. My husband or we kind of have a system worked out. And so about a week before I went into labor, I had found a podcast. It's like birthing affirmations, Christian birthing affirmations. And so I had been listening to that for just like a week. And so I had my husband turn that on, and my water broke at 3 p.m. We got to the hospital at 4:20. And so my doctor came in, he checked me at about 5 p.m. and said, yeah, you're like 3.5 centimeters, which is great. You're 100% effaced. So, I'm excited for you. Maybe tonight, maybe tomorrow. Let's just kind of see how things go. And so at that point, I was pretty much heading into like active transition. It happened so fast that it's very hard for me now looking back to decide where I was. We had friends drop off food for my husband. I did not want to eat. And yeah, I just kind of went into this place. I labored a bunch of different ways until I finally found that all fours is what worked for me for most of my labor. I only snapped at my husband once. I had asked him to give me counter pressure, and then 2 seconds later, I didn't want it anymore. And so I was like, get off of me. So he was proud of me for only snapping at him once.
Now, was your labor was it a lot of back pain? Is that why you found the hands and knees
No,
comfortable, or just?
I didn't. I just felt like having that pressure, first, it distracted me from the pressure of the climax of the contraction. Just like
Yeah,
the
I labored.
counter.
I did a ton of my labor, hands and knees, and then on the toilet were my kind of two favorite
Yeah.
positions. Yeah,
Yeah, I
totally.
actually was on the toilet a lot in the beginning. I was like, this is gonna open me up. And my husband's like, what? Like I'm like, were you paying attention at all during our child education class? So yeah, then it felt very, very quick to me. And then I remember looking at my L&D nurse with like tears running down my face and saying, there's no break. Why is there no break? Like the breaks aren't happening. And she's like, just let your body do what it needs to do. And obviously for women that have done this, it's so intense and it's so hard to put into words how you're feeling. But I felt calm. And I wouldn't even necessarily say like it was incredibly painful. It was so intense. That's the word that I used. And I was listening to my affirmations, like telling me that I could do this, that each contraction was bringing my baby closer to me. And I just really kind of got into a rhythm. I kept the lights off, very quiet, asked that no one really talk. And I looked at my husband and I was like, I have the urge to push. And he was like, there's no way, there's no way you're ready. Like we've only been here for a couple hours. And so the nurse, she said, would you like for me to have the doctor come check you to see how far along you are? And I was kind of like, oh, I don't know, because I didn't want to feel defeated if I, was only in a certain number. And I said, yes, just we'll see. Sure enough, I was at a 10 and fully effaced and ready to go. And I just like at that point, you kind of get this like resurge of like adrenaline, and you're like, yes, the pushing part. And you kind of go through the cycle again of how you feel while you're pushing. So I, of course, have no concept of time. I am like, sure, it's like 1:00 in the morning at this point. And they came in. I did decide to push on my back, which looking back, I wish that I hadn't. I just like felt, I don't know why I decided to do that. But I had a great team there coaching me. My husband was up by my side, just assuring me that he was like, the hard part's over. Like, this is the pushing part. Like, you're going to do great. And just really motivating me, which is what I personally needed. And so, yeah, I pushed for about 22 minutes, and my little sweet baby girl, she was a tiny tot. She weighed 5 pounds and 1 ounce.
I was gonna say she's probably pretty wee given all the stuff. Hey, yeah.
Yeah, she was super tiny. And yeah, it was amazing. And it took me a little while to like get in the rhythm of pushing. I'm sure most people feel that way.
Totally.
Yeah.
You've never done it before, right? It's a new skill,
Yeah.
right? Yeah.
But the nurses were so great. And like I asked them, I was like, please like walk me through like how to do this, And so they were great in kind of coaching me through. And yeah, she was here and she looked great. She didn't have club feet, and Her APGAR score was great. And obviously she got checked out a little bit more thoroughly than a full-term baby would have. But she was breathing and crying and a healthy, beautiful pink. And so then I got to have my sweet golden hour with her. And yeah, it was amazing. And I remember when they put her on my chest, I looked at my husband and I was like, what day is it? Like, what time? And he was like, we had a Halloween baby. And so my total labor was like, from when my water broke until she was born was exactly 5 hours. And
That's
16
incredible.
minutes. Yeah. So
Wow.
it was
Wow.
really fast. My doctor was like, don't tell any of your friends. They're going to be so mad that your labor was short. But yeah, so it was such an incredible experience. And my whole life had been so afraid of birth. Not really for any particular reason. I think I had just seen what's in movies and TV shows, and you see this woman like screaming her lungs out. And I was like, wow, it doesn't have to be like that. And it can be an experience that you look back on with joy. So yeah, that's part of why I decided to become a doula.
That's incredible. And do you think, I mean, because Sarah and I, the main reasons that we've started kind of She Found Motherhood is that we want exactly that, for people to come out of their birth experience and look back on it with joy, not with, trauma, not with, I wish I had, I should have, I didn't feel like I knew what was going on. And so part of what we are trying to do is empower people with knowledge so they know what to expect going in, what the possibilities are, so they can feel comfortable in their decision making. So do you feel that kind of that preparation, you've done obviously a ton of research, I can tell just by talking to you. But do you feel like that preparation helped you feel comfortable? I mean, your birth went amazingly. It was kind of that kind of quote unquote, I'm using air quotes, quote unquote, kind of like ideal birth, it sounds like, other than it was a little bit early, but all turned out well. But do you think that preparation helped you actually feel comfortable in that situation?
Oh, for sure. And like, I look back and think about how anxious I was during my pregnancy, and like the fact that my water broke and I was laughing. Like, I knew that mostly me, but my husband as well, that we had prepared as much as we could. And that my body was going to do what it needed to do. And I trusted my medical team enough to know that if something was going to occur, I knew that they would listen to me, right? I believe hugely in the woman being an advocate for herself, but knowing that they would do what was best for me and our baby. So definitely, like, we had it was via Zoom, of course, but our childbirth education course helped a lot. And then obviously just me reading myself, and listening to birth stories. But yeah, I think that the biggest thing is that, like, I've had close family and friends who their birth didn't go the way that they wanted, but they still came out of it okay because they were educated and knew kind of what might happen or what could happen. And so I hugely advocate for any type of prenatal course that you can take, labor courses, breastfeeding courses, anything that is going to even help you, just to know that there are, people out there that want to help you and give you the support that you need. I think is super important.
Yeah. And I think the other thing you spoke to is that trust in your care team and having that open communication and knowing that they would respect your wishes, but that if they had concerns, they could talk to you about that, and you would be able to understand and make the decisions to keep your baby safe, right?
Yeah. Yeah.
So how did the postpartum go? Did Miss Savannah get to stay with you postpartum? She didn't need to go to the nursery or anything like that?
No, she didn't have to go to the nursery. She was with me. Everything was great. She had a lot of difficulty latching, which is somewhat common with premature babies. I also had super flat nipples, which I didn't know was a thing until everyone's like, oh, I'm like, okay, no one talked to me about this before. So our breastfeeding journey was a little bit difficult in the beginning. She did end up having jaundice. So we went home after our 2 nights there. And then the following morning went to the pediatrician, and we knew, I mean, she looked like she'd been in Florida tanning. So we kind of knew. And so we went back to the hospital for a night, just for her to get her bilirubin levels back to where they needed to be. And that was actually great for me because I got more support from the lactation consultants. And so any mom listening, when you are in the hospital, or if you have access, if you're not birthing in a hospital, get support from a lactation consultant. They are incredible. And can, even if your baby latched immediately, it just helps to have that support, and someone who can help you. So,
And they can show you different positions you had no idea about that can work in, like, yeah, I agree with you 100%. And so did Savannah have to do so for the jaundice? I don't know if people are really familiar with jaundice, but did she have to go under the lights? Like, did she have her little, or a billy blanket or something like that?
Yeah, so her levels were high enough that we could go to the hospital just for like the 24-hour stay rather than doing the blanket at home, which would have required us driving back and forth. So we just opted to do that. So yeah, she was under the lights for, her levels actually came up so quickly that we didn't even have to stay or go down the full 24 hours, which was great. And she was fine after that. So but yeah, so feeding was super important. And I had told myself from the beginning, I was a formula fed baby. And I had told myself, if breastfeeding works and it's something that I want to fight for, I'm going to do it. But if it comes at the expense of my mental health, like I'm not going to do it. So, after that stay and the extra support from the lactation consultant, that made all of the difference. And so, we're a little over 5 months in and still have a great breastfeeding journey. And I'm just really grateful for the support that we received to be able to do that. So
Amazing.
yeah,
Thank you for sharing. That's a wonderful story. Hey, like
yeah.
challenges for sure, especially in those early days, right? Well,
Mhm.
a lot of challenges in the early days. But just a wonderful story. So we kind of like to ask everybody this: what is your kind of fondest memory, or what is the thing that that you will always kind of remember from your experience?
um, Probably, I think just right after she was born, and they had checked her out and brought her back to me, and I just kind of looked up at my husband, um, and we laugh all the time, just kind of laughed like at how much worry and anxiety we had, and yet how beautiful this baby girl was, and that she was ours. And it was just such a sweet moment of kind of reconciliation of trying for such a long time, and or what to us felt like such a long time, and having somewhat of a complicated pregnancy in the beginning, and then just being able to have the experience that we had with bringing her into the world. I can, like, clear as day remember that moment. So yeah.
Amazing. And what was your biggest challenge through your journey?
I think postpartum, um, everyone will tell you sleep deprivation is such a real thing. And so just having support, especially for those of you giving birth during the pandemic, like whatever that looks like, because you don't want to cook. You are just so tired, and those days are kind of a blur. So probably making, like, prioritizing sleep was a huge challenge for me. And I finally had to, like, trust that my husband is her father and that he was going to do a great job for me to go sleep for a couple of hours. So yeah, the first couple weeks with that. And another big challenge was when he went back to work, and me just being home with her on my own. It just was a big shift to not have him there. So finding all the support you can get and whatever that looks like. We had people drop off meals outside, for us, was super helpful, to kind of get us through those days of, you just, like, time is such a weird thing in the newborn phase.
Yes.
You're like, the day is so long and yet it goes by so fast and you feel like you have gotten nothing done. But
I was talking to one of the nurses who was there with my second when I went in, um, yesterday, and we were just, because her birthday just came by and she turned 7. She's like, but that was like 3 or 4 years ago, right? I was like, no, she just turned 7. Like there's a saying, right? The days are long and the years fly by. And it is so true. And no more, like, it's just so true, especially, and you see that when you have kids, right?
Yeah.
Because you're just like, where did the time go? I still feel like I'm an 18-year-old,
right?
right? Like it's crazy. And okay, so you've kind of stepped on one, but what would your piece of advice be to those people listening who are pregnant with their first babies now?
I think the biggest thing that I've learned through friends and just my own experiences, you're going to get a lot of advice and a lot of people are going to say things to you. Take what feels right for you. You're the best mom for that baby, and just let the rest go, and enjoy the experience. So that would be my biggest piece of advice.
Amazing. Well, I am so excited for your upcoming journey of becoming a doula.
Excited.
That is wonderful and incredible. And I think you will do a wonderful job.
Thanks. I'm excited. Thank you guys so much. Your resources are amazing. And just thanks for doing that. Instagram has become such a great place, and these podcasts to be able to help moms feel not alone. So thank you guys for doing that. I really
thank you for that feedback.
Yeah,
it's
of
nice
course.
to hear that. All right, awesome. Well, have a lovely day.
Thank you.
And give that little Savannah a snuggle for me.
We will. Bye. Thank you.
Care. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.